All right, I think we can go ahead and get started. Welcome, everyone. Thank you for joining us today for this webinar on open defecation, which will be a discussion about the practice and its implications. My name is Melina Alexanian. I am the program administrator for the Center for Emerging Pathogens at the University of Southern California, USC. I would like to welcome Dr. Neha Nanda to take over.
Thank you, Mel. Welcome, everyone. It's a pleasure to see some of you again. I think we met a few weeks ago. Today, in collaboration with Public Health Aid Awareness and Education Agency led by UCHECI, and in collaboration with CEP, that's the Center for Emerging Pathogens at USC, we are hosting this webinar to discuss open defecation and its implications, and what do we have in place to reduce the incidence of open defecation and prevalence of open defecation. And we have Dr. Tukur joining us as a panelist, and we look forward to a lively discussion. UCHECI, if you'd like to say a few words about your organization and yourself.
Thank you, everyone. Thank you, everyone, for attending. Thank you, Dr. Nanda. Thank you, Melin, for everything you've been doing. Thank you, Dr. Tukur. My name is UCHECI. I'm the founder of Public Health Aid Awareness and Education Organization. We have been working in the area of WASH for a very long time now. And since inception, we've focused our work on marginalized areas. So we think that at this time, open defecation is a subject that needs to be addressed. So with the partnership of Dr. Nanda, we hope to have these discussions today. And I promise that it's going to be a very informative one, and we all will join hands to see what we can do to curb open defecation in Nigeria, most especially. So I look forward to an interesting time. Thank you.
Thank you, UCHECI. Dr. Tukur, if you'd like to say a few words about yourself.
Okay, thank you very much, Dr. Nanda, and all the other colleagues. My name is Dr. Tukur Ismail, and I'm the Executive Secretary of the State Primary Health Care Board. We are basically providing the basic health services in Zamfara State under the primary health care. I'm glad to be part of this very informative discussion. Thank you.
Thank you, Dr. Tukur. And with that, what we'll do today is we'll have a discussion about where the current status of how things are with open defecation globally, and with a focus on Nigeria. And then after a lively discussion, we'll open it up to Q&A so we can actually have a dialogue. With that, I think, let me start by saying that, you know, as a global community, we have lagged behind in reaching our goals for open defecation. If you look at the UN sustainability goals, they talk about that if we continue at this pace as we are now, we are not going to achieve our goal in the near future. And therefore it becomes really a public health emergency, so to speak. And here the numbers are humbling. I recall reading numbers that stated 673 million people do not have access to toilets. And more than 90% is in the rural areas. And what's so humbling is looking at the number of deaths that are occurring annually. And we are talking about almost 1 million. It's 800,000 deaths as a result of diarrheal diseases, wherein the cause often is lack of access to sanitation. And we have about 1,000 children die every day because of lack of resources that some of us just may take for granted. So I think there is immense urgency around all this. And if we look at Nigeria, some of the numbers that Dr. Tukur and Ochechi, we all have been talking about, 46 million people today practice open defecation in that state. That's about 23% of the population. Then there are areas and pockets where the prevalence is high. There are areas that have made some headway. But I think it lends us to question, why is it still so pervasive? What is the reason? And I'd love to hear from you, Dr. Tukur. Why do you think, you can speak from a global standpoint, you can speak from your experience. What do you think? Why is it still so pervasive when we've been talking about it for so long?
Okay, thank you very much. And you have rightly said it. It is a public health emergency, actually, because of its potential to cause a lot of diseases and illnesses. So there have been a lot of giant stride by the Nigerian government at all levels, the national level, the state level, and the local government level, at individual and community level. But despite that, there have been some challenges that led to, if you like, a snail pace improvement in terms of achieving the open defecation free in the country. One of the major challenge, I think, is the social custom and belief that some people have. There are disparities in income is one of the major causes. And there's also lack of appropriate technologies and options that people could use. You see, if we take like Nigeria has a very large geophysical conditions that varies across the northern part, the southern part, the south or southeastern part, ranging from a swampy soil to waterlogged areas to the system, as it's trying to come up with technological solutions that can help ensure safe latrines, you find out that there is variation in the needs, and this variation comes with variation in cost. So these are some of the challenges that made it a little bit difficult. Another challenge is that all the focus were on individuals and communities. The government ignored the larger proportion, because now we are seeing our coverage is about 76%, but the remaining 33%, you find that is along where people gathered, like the motor parks, the schools, hospitals, prayer like churches and mosques. This is where you find out there are no wash facilities in most of those places. So there's that aspect. There's also lack of integration and intersectoral collaboration. Right now, you find out that the role of ending open defecation is mostly led by Ministry of Water Resources or WASAN with support from other non-governmental organizations. But ideally, it should be an intersectoral collaboration that involves the Ministry of Environment, Ministry of Health, Ministry of Agri, law enforcement agencies, you know, a lot of other ministries that needs to interrelate. And another reason why this thing was still striving is the fact that there is no social marketing of sanitation. You know, social marketing in the sense that disposing fecal material appropriately can generate income. And if you want to start that, you have to start, it's a process. process in the sense that one, you have to develop a technology that is acceptable and affordable to people to use. You understand? Now, after generating that, you also generate a means where people could be educated on the benefits of using that. That brings about what we refer to as the behavioral change communication, because you cannot just take it one lane by providing maybe the hardwares that are required to ensure proper sanitation. You have to bring along and tie it with the behavioral change communication to bring people and make them own the process and see the benefits that they are likely going to gain from it. So, like I said, a lot has been done, but we still need to bring our heads together to ensure that we achieve this very important goal that has potentials to impact on different, other goals of the Sustainable Development Goal.
So I think if we had to, that's really helpful, Dr. Tukur. So as you kind of shared with us, I think the big gaps in different buckets would be in any effort, there needs to be more collaboration at different levels. And there needs to be a behavioral education around behavior and of course, resources. And, you know, I think I was reading an article where they talked about how even there's some people by compulsion that they do not have access. So by compulsion, those families have to practice open defecation. And then there's another group that it's behavioral because they talk about, you know, it's an outing for them. It's a time for them to socialize. It's a time for them to bond outdoors because that's what they've done. They don't want to miss out on that. So I think it is so entwined within the culture. And that's where what you're saying is collaboration at the most grassroots level is so important. So we have, I mean, you know, we have made headway from what I understand, but there's, and we'll talk more about the numbers, but clearly there are opportunities like you outlined. Let's pivot to, with all these challenges that we have outlined, given the burden of open defecation right now, we know that there are huge implications.
Yes.
Mel, if you want to pull up that slide, huge implications. And here we are talking about implications around health. We are talking implications around the social aspect, and also there's a financial impact to it. And also there is a vulnerable group, that's children and women, who are very adversely affected and more so affected. But just for the group to share some numbers in terms of disease, you have about 6,000 deaths. This is in 2016. This is global data. You see these soil-associated helminthic infections, around 6,000 deaths. This is the burden that we are faced with, malnutrition. And as a result of that, you're so well aware that can have a tremendous impact. And you can see the population that has been that you can attribute to these diseases. It's about 1%. So that's pretty impressive. And when you think about diarrheal diseases, you know, being an infectious disease physician and having trained in Asia and in Africa, where you see things now, we have seen cholera, which we talked about at our first webinar. We see Shigella, we see Salmonella, we see hepatitis A, typhoid. Not too long ago, it was polio, which now, of course, we've made headway. Giardiasis, it goes on. And it all comes down to, if you think about it, because of the site where open defecation is happening, when there are waterways around it, there's contamination. Or you talk about, like Dr. Tukur was saying, wherever there's waste, there is going to be insect infestation. And that results in diseases like cholera. And with women and children, we have seen some case studies and numbers just talking about such a impressive impact on them that I think it really behooves us to talk more about it. Dr. Tukur, I'll let you enlighten us on any information that is particular and specific to these groups that you're able to share with us. Mel, if you want, you can pull down the slide.
Yeah, thank you very much. You've rightly said it all. Um, the potential of open defecation to cause diseases is not far-fetched. The reason being that for every gram of feces, we have not less than 10 million viruses. We have about 1 million bacteria. We have 1,000 parasite seeds and about 100 eggs. So you now look at the mode of transmission. Some fecal oral, which is very high. Some goes what we refers to as percutant, that is from the surface to the body straight. So now if you look at the most vulnerable among them are women and children. So the infestation or the affectation of infectious diseases from open defecation are like you rule them out, but I still have like the under the maternal, what usually affects the mother usually affects the child, and sometimes it's like a continuum. When the mother is affected, eventually it will affect the child, especially in relation to pregnant women. So you find out that it is a chain of reaction. For example, if we look at the helminths, generally hookworms, the Ascaris lumbricoid, the tapeworms, all these parasitics that I get infested usually through contamination of food or hands or other utensils. They end off in leading to what is referred to as chronic anemia. And we know chronic anemia affects the mother because it's make sure that it does not have enough blood within her own system, and that inadvertently affects the child himself by leading to what we know as low birth weight. And we know low birth weight is one of the major cause of infant deaths, you know, and then it could also lead to preterm delivery. Preterm delivery is also one of the causes of infant deaths. And uh, by the time the anemia can be a secondary cause of maternal death, especially during delivery. If there's excessive loss of blood in presence of anemia, you find that before resuscitation take place and other things can claim the life of the mother. So on the maternal side, you see a chain of things that relates to that. Now on the child, it all starts from ordinary diarrhea. The diarrheal disease, which is as a result of an open defecation where the flies perched on it, or there is inadequate hygiene in where the food or utensils are contaminated, and eventually a child gets the diarrhea. So that is the beginning of the problem. The diarrhea may lead to malnutrition, and malnutrition eventually leads to immunodeficiency, because once there is no adequate nutrition, immune system will not be very, very effective. So malnutrition may lead to immunodeficiency, and when the immune system is weak, you find that other opportunistic infection will infest, and that may lead to child death. So if it does not lead to child death, it can affect his cognitive ability, which eventually he might not be able to reach his actual potentials in life because he's affected at that time. The brain is growing, everything is growing, and then there's not enough nutrients because of the malnutrition. And then another complication is stunting. Stunting and wasting as a result of malnutrition can adversely affect the life of a child. For example, if I should go back to the maternal aspect, some of the major causes of maternal mortality is obstructed labor. Obstructed labor comes from a contracted pelvis. Contracted pelvis is one of the complications of wasting and stunting. When a female child is growing and she did not have adequate nutrition, she will get stunted. And by the time she got stunted, she will have a contracted pelvis. And that contracted pelvis predisposes her to obstructed labor in future. And that leads to maternal mortality. So you find that there's a link, but it's not directly. Sometimes you see them directly, sometimes indirectly, leading to all those causes of disease and illnesses.
Dr. Tukur, you touched on something that I think there are, I read these numbers, and tell me if in your experience it plays out. There was this very nice study done where they talked about the susceptibility of pregnant females to hookworm infections in areas where there's open defecation compared to women where they have access to toilets. The numbers were impressive. Women with hookworm infections, when they did not have access to toilets, it was 24%. People who had toilets, it was 6%. We are talking about 4 times higher incidence of hookworm infection, which you rightly said. In a mother, you can see how it would lead to anemia and all the complications you're talking about. Is this something that you even see in your practice? The difference?
Yes, quite. We find out that the infestation, that study, to further corroborate it, you look at the hygiene aspect. Like I said, the mode of transmission of even the hookworm itself is orophycal because of open defecation, maybe as a result of water washing up the feces or improper sanitation at the end of visiting the toilet. And also hookworm can someone can get infestation right through the skin. So those are some of the reasons why the study has a lot of facts to say that those with toilets are more safer than those that have open defecation.
Yeah. And then I think there's another thing that we had talked about was the difference in the body mass index and hemoglobin in groups that have access to open toilet and defecation. And it was about an 8-point difference in people who have access to have access to toilets and do not. So clearly there is a huge need to be able to quickly and rapidly try and stop this kind of these kind of consequences. With that, what's also very it's not, I mean, we've known about it, but when you look at numbers, there is information out there talking about how there's increase in sexual violence in girls and women, and where there's access to toilets, it's much lower. It's 2 times higher in areas where people don't have access to toilets, and they have to, they have to succumb to open defecation. So that's another piece that kind of really makes it an urgent issue.
Exactly. That touched on human dignity and rights as well, because I think there's nothing as disgusting as a sight of a young lady or a woman squatting to defecate or things like that. Is quite disgusting. And you rightly said the studies have shown that mostly, because if they are going out for open defecation, they mostly go at night. So that makes them predisposed to attack and sexual assault. In most cases, you find they are even being killed in the process. So that is a serious human rights issue. Like I said, their dignity, and that has been associated. You see, there's a study I also saw that shows that the rate of school attendance among girls, there's a great variation between the school that has sanitary or toilet facility within the school versus the ones that do not have, because we know the regular monthly period that the young girls do observe, that anytime they realize or they are expecting to have their menstrual period, they decide not to go to the school because it can come anytime and they could be embarrassed in the process of getting themselves clean in a safe toilet where they have water and everything, as opposed to where they don't have the sanitary provision within their schools. So
Yeah.
it's a very serious social issue.
Yeah. Dr. Tukur, if I may, I think it's echoing, at least at my end. If you can move that mic a little away from your mouth, that'll help. But thank you. Yeah. This is, yeah, it makes it a true public health emergency. Now, we've talked about social implications. We've talked about consequences on the health and well-being, especially in women and children. I'll talk a little bit about some numbers that I thought were extremely staggering, where they talk about, Mel, do you want to pull up the slide on GDP? So with all this, we know, we need resources. And this is from a UNICEF document where yeah, that's all right. Where we look at here the gross domestic product, how much, what percentage of it is getting lost because we don't have adequate sanitation. And you can see globally it's 1.3, but you clearly see certain parts of the world it's disproportionately getting impacted. It's about 3.2% in sub-Saharan Africa, which is impressive. Mel, you can take that down. And then when these numbers from Nigeria and Ghana, they talk about the amount of financial impact varying. In Ghana, it was 290 million loss. This is in US dollars, $290 million lost annually. And more than 30% of it goes either in finding access, just looking for a toilet. And they put a number up at $19 million in looking for a toilet. That much of time gets lost. And then, of course, healthcare costs, and then premature deaths. Out of the 290 million, about 200 million goes in premature deaths. And that's what Dr. Tukur also talked about. This is impressive. This is Ghana. And here we are talking about, in our collaboration with our panelists, we are talking about Nigeria. The number quoted is 3 billion lost annually. And again, they talk about 243 million lost in simply access and 2.5 billion in premature death. And the remainder gets divided in healthcare costs, in in funeral costs, and epidemic outwork and outbreak workup. So you're talking about a huge amount of money in a country like Nigeria or Ghana. You're losing tremendous amount of money. So I think without a doubt, we want to be able to accelerate where we are today. And I really, what echoed with our center was the key accelerators that have been outlined by UNICEF. And they talk about 5 key accelerators that will help us get to the next level. They talk about governance, where there needs to be effective coordination, what Dr. Tukur was talking about. There has to be crosstalk at all levels in all worlds. Then they prioritize financing, that's resources, of course. Third, they talk about capacity development. This is both in terms of education and infrastructure. Then another priority is data and information. And last but not the least is innovation, the new technologies that are out there. So with that, I know there are efforts that have been in place. And where are we today? Mel, do you want to show that slide where they talk about the success thus far? And first, if you show the framework, yeah, this is just for reference for everybody. Many of us may be very familiar with it, that this is how the service level is designated. So we ultimately want to get to the dark green part, row, that's safely managed, where the facilities are improved and it's not being shared among households and it's being safely disposed. The worst is open defecation, and that's what we are discussing. And then you see in the middle, you have unimproved, where you have pit latrines, and limited, where you have improved facilities, but it's getting shared. And basic is where you have improved facilities, but the way it's disposed and transported is not ideal. So Mel, if you can move to the next slide. Thank you. So if we look at our progress as a community, these slides are from UNICEF documents and WHO documents. Look at the change that you see in coverage of safely managed. We moved from 28% in 2000 over 17 years to 45% of the world population. That's great. That's great. But clearly there are pockets where more needs to be done. Because from what I recall, and I know Chechi and Dr. Tukur will also weigh in a few minutes, is Nigeria, it didn't make the kind of impact that we would like it. I think it just moved up 2 points, but we'll talk more about it. Now, looking at this schematic, you also see an increase of the light orange part. That is 9% of the population now, and it was 17%. So that has reduced. So that's great. But clearly there is a need, without a doubt, there is a need. You see the orange, light orange, dark orange, it was wider, it has shrunk, but still cumulatively right at the bottom, you see 18% here is extremely suboptimal. If you forget the green entirely, it's 18 plus 8%. So you're almost saying 30% of the population still does not have anything close to where we would want to be. And with that, I wonder if, Dr. Tukur, you'd like to talk a little bit about what's being done in Nigeria. And then Uchechi, if you'd like to share a little bit about Abuja in terms of the progress. Dr. Tukur, please.
Yes, thank you very much. Like I said earlier, that the government of Nigeria had been highly committed to ensuring that this goal of 2025 open defecation goal is being achieved. At the country level and state level, there's a lot of efforts that have been done. I know there are policies that are being implemented, like the water and sanitation policy, like the National Task Group on Sanitation, establishment of the WASAN and implementation of their activities, and a lot of innovation in terms of the strategies and approaches that are being used, to ensure that the implementation of those policies is achieve the desired goal. One of the giant strides taken by the country is to have a paradigm shift from a situation where the approach was to support and subsidize the provision of the toilet materials, the hardwares to people, to a community-led approach, which is community-driven, where the community led total sanitation strategy is being implemented and strongly supervised as the major means of driving the ODF process. So that is what the current strategy that the country and all the states in the country are adopting. So if you take, for example, in my state, is on first state, there has been a lot of improvement. I think the most recent findings
Dr. Tukur, you're on mute.
Okay, sorry. Okay. So if I said like if you come back to my state, Zamfara State is one of the least in terms of ODF, which at least 2%, and it also have one of the local government that is declared as ODF free out of the 14 local governments. And because this strategy is being implemented at community levels, so you find out that more than 50% of all the communities within our states have been sensitized with the first level or first step of the community-led total, the community-led strategy of eliminating the ODF. So following the sensitization, there are other steps that are expected to be implemented. So these are where we are having some of the challenges to follow up, challenges to maintaining the achieved status. Because sometimes you see a community will achieve a status of open defecation, but the maintaining that status is one of the challenges. You know, they tend to drip back if the constant surveillance and supervision of the processes are not being maintained. So these are some of the issues that our state is currently addressing. And because our state also, with the support of UNICEF, has developed a roadmap, adopted and developed its own roadmap for achieving the ODF target of 2025. Under it, a lot of activities are being enrolled, and one of the major targeted areas are the schools, mosques, churches,
Got it.
motor parks, markets,
That's
given
great.
the
That's great.
greater priority. Yes.
Okay. Uchechi, would you like to share your experience around Abuja?
Yes, thank you, Dr. Nanda. Thank you, everyone. Yes, recently there has been an official declaration of state of emergency on water, sanitation, and hygiene in the country. And that has put a lot of work in this area. Like in Abuja, there's a lot of, there are about 6 area councils. There is Buhari Area Council, Kuje Area Council, Abaji Area Council, Gwagwalada, and the Abuja Municipal Area Council. And the previous work that was done by Ruwasa, 3 communities out of 10 in Buhari Area Council were declared open defecation free. Just like Dr. Tukur rightly said, maintaining those status, that's the thing, you know. Yeah. And those communities are Kuchingui, Zuma 1, Zuma 2.
I see.
Is maintaining those status, even though that right now the statistics reads that 39.4% of people living in the FCT practice open defecation. So that's a little bit high. Now, speaking on field experiences from the work that I've done, like I said, I keep repeating myself on this issue that we went to carry out hygiene promotion activities for students, for pupils in public schools, because our work is usually targeted on the marginalized communities. And when we got there, we found out that they had no water and toilets. So we put a halt kind of on the hygiene promotion activities. I mean, what would you be promoting if they don't have water and toilets? So we had the project overhaul, and then we decided that they would first have water and toilets. But before we did that, we went to the LEA board to get a list of the schools in Amak, because our office is situated in Amak. And so we started working with Amak before we went to the other area councils. And when we got the list of the schools, I mean, they were like a mountain high number of schools that do not have water and sanitation. And I began to ask, how do you build schools without making provisions for water and toilets? How do you want them? And when I asked the rulers of the communities, we discovered that the rulers take it upon themselves to build these schools for their communities. So, and I also asked, in the houses in these communities, do you build toilets? Not really. Sometimes they build toilets, sometimes they don't build toilets. So it's not really something that it's not really top on the priority list, like something that they would go for on a very good day, So
yeah, that's behavioral, right? I mean,
that's the behavioral.
How do you?
Yes.
Yeah.
Like you said.
Yeah, and with
like
all
you said,
this, yeah, go ahead, please.
Like you said, sometimes they look at it as a time to socialize and catch up on things, that kind of a thing. So that's how it's seen over there. It's really not a big deal. A child just walks out of the classroom and just goes to some shop very close by and just do his business. And he just walks into the classroom. It's really nothing, till he gets back. So my own concern is, are there policies? And we are an impact-driven organizations. I don't believe in coming and talking and there's nothing done. We are an impact-driven organization. Is there something that can be done? I mean, when you want to build schools, you factor water. I mean, it's just the basics. Factor water, factor toilets in these buildings.
Yeah.
That is, in my opinion, there has to be a law that says that at least we start that, then begin to talk about maintenance. But let's put the first things first. Let's put the first structures on ground first before we now think maintenance and behavioral changes. So this is about what I found out in the field and from the statistics in Abuja.
Thank you, Uchechi. And I see some hands up. We'll get to you just in a minute. So Dr. Tukur and Uchechi, in their own worlds, have shared with us where things are, what are the challenges. And if you look at the numbers since 2019, if you look at Nigeria as a state that all of you know more than I do, there were out of around 774 areas. In 2019, there were only 19 areas, 18 areas where open defecation was declared free. And now it's up to, I believe, around 71. But there's a lot of work that has to be done. And with that, I'd like to share with you a pilot project that we have taken on as a collaboration between CEP, USC, and PHAAE, that's Uchechi's organization, where what we want to do is, we've looked at different case studies, different things that have been done globally. The ways to do it is, programmatically. Like in India, they undertook Swachh Bharat. It was a programmatic thing. They gave the resources to the local communities and held them accountable for how they want to do it. Then other places have actually done door-to-door things where just small groups take it on. What we thought was in Abuja, we are going to launch a program where in collaboration with PHAAE and just assess what's the awareness level. And then we plan to educate them. We'll have, either we use train the trainee or other ways. And then we will, after that, measure the impact of that training, and that will ultimately show in practices. This is a pilot and it's phase 1. And at its conclusion, we would love to share our results with the group here. And you know what, I'm going to stop there because I see there are some comments in the chat and there are questions, and we would love to take questions from anyone. Let's start with Dr. Aluwadele, if I said it right. I'm sorry if I didn't say that right.
That's okay. Thank you so very much for having me. This is my second time of coming here. I listened attentively to Dr. Tukur, and he made a lot of salient points, and I also have to commend them, both Dr. Tukur and UC, for the job they are doing to bring this into the open knowledge and having a discussion around this. One, I think there is an issue that we also have to go by, which does not only affect this. There is this lack of what I call street level bureaucracy. I remember when growing up, we have these sanitary inspectors in the 60s, in the 70s, whereby they go around the communities and they ensure most of these things are, are reduced to the barest minimum. The kind of street level bureaucracy we need now, for instance, any new school, any new community, any new public like garage, like motor parks, there should be an inspection to ensure that all those facilities are included at the construction stage. So we need also the street level bureaucrats. We also should be going there constantly to ensure that they are maintained. I remember that some of those facilities, especially in Lagos in those days. But because of lack of maintenance, because of lack of supervision from the government agencies, they become unusable after a very short period of time. So we have to look at the policy level, how we can bring about this kind of street level democracy to ensure that compliance at every stage, both in construction and in maintenance. Then we also should look at about creating maybe a social entrepreneurship around this. I remember that this man in Lagos who's late now is called, he used to refer to him as Otumba Gaddafi. I think the guy derived his name from Gaddafi of Libya. And he started this mobile toilets, facilities, and they call it shit money, no the smell. Sorry for those who may not understand pidgin. That's actually a big business. And why I'm talking of social entrepreneurship here is like most people who may want to, if you bring in private sector because of the profit inclination, they may be overcharging the community, and especially in the rural area, they may not be able to afford such the usage of facility by the fee they are asking them to pay. But if we have a kind of social entrepreneur who are ready to, as a part of maybe big organization, we can also kind of market them to use as part of their corporate social responsibility to communities. For instance, maybe a bank is talking of CSR. You can say, okay, why not supply mobile toilets to 50 schools in a particular, 10 schools in a community and all that. So you are not going to make profit there and all that. So and when they install this, then we need the, what I said earlier on, the street level bureaucrats to ensure that these things are maintained, that they go there constantly to ensure that it is maintained. And of course, there should be penalty for non-maintenance, because it has a lot of implications, as we have had, health implication and all that. No, in fact, it's very saddening that at 21st century, we are still talking about this issue. But then that is the reality we have found ourselves.
You said it very well, right? I mean, sustenance and then incentivizing,
Exactly.
right? All that comes with having some kind of inertia of motion. Once things get started and people take to it, that's when people invest more. Thank you for your comments. I see Mr. Ayortiom Stephen, please go ahead.
Okay, good evening, everyone. All the speakers have spoken very well, but I feel that when it comes to the issue of open defecation, we should seriously engage rural communities on the areas for behavioral changes. Because if we don't engage them for behavioral changes, no matter the facilities that are in place, they're not going to use them. I've been in the field, I've seen the community people, but most of them have issues which at times you can't even understand them. So I think we need to do a door-to-door campaign. And secondly, we need to sustain such campaigns, visiting frequently, which I would suggest to all of us here that maybe before this meeting ends, we should all drop our emails and WhatsApp numbers so that we all form a collaboration. It's a very big fight and it's a very big one. One, we need to fight for government policies that favor sanitation and hygiene. There need to be a standard task force down from the National Assembly in Nigeria. They should ignite a task force that is going to work door to door down to the local government sector. So thirdly, as on the area of girl child education, there are girls that don't go to school when they have issues that menstrual cycle, which if the government cannot provide sanitary pads for them, they should remove VAT on sanitary pads so that they should be accessible to people from the rural communities. Which I feel a gathering like this is something that we should all come together, make a very big force, sit down and set up a roadmap on how we can achieve this. Thank you.
Yeah, very well said. And I see a comment from Dr. Bolu Anabuli. Bulu. I'm not doing justice to your names, I know that. But Dr. Anabulu, if you'd like to just share your thoughts, I see it typed out so people can hear.
Very much. I just made a quick comment to what the last speaker was saying about the rural areas. And I was saying that it's not necessarily about the rural areas, that the urban centers sometimes also have a problem with sanitation, with proper sanitation. And I believe it's a mix of things that some of the speakers and those who have made comments have mentioned. It's a mix of things. It's the intrinsic behavior change. It's the having access to facilities, because even if one wants to change and they don't have access to facilities, and it's also the, I don't want to use the word policing, but all of that is necessary. And I'm just saying it's not just for the rural areas.
Yeah. Thank you for your thoughts. There is a comment in the chat where someone thanked you, Chechi, Nanpet Chuktu, saying that also they feel that the Ministry of Education, who certifies the establishment of school, there should be a policy to having wash structures so people get educated. And I think that's nicely ties into what Stephen was saying, that that's how you kind of introduce a behavioral change. If from the start, you encourage people to think the right way. Nanpet Chuktu, if you're on, if you want to kind of share your thoughts, and if I did justice to your comment, please.
Thank you. Hello?
Yes, please.
Oh, thanks. Yes, so I really like the focus on the FCT. But I think we can take our advocacy to the Ministry of Education. They certify schools. It will be important to dig out that policy and use that policy to push for an investment in the wash infrastructure. So, yes, some of the schools are built by the local community, but the Ministry of Education sends the teachers and there. It then means that the municipality and the Ministry of Education needs to invest and ensure that no school is allowed to exist without at least the basic wash facilities. I think it could be a start.
Yeah, I think you make a great point. Mel, I kind of started going through the questions because some came directly to me. Do you want to just, if there's anything that I have missed, if you want to comment on?
Yeah, we went through the questions that were submitted in the chat, but if anybody else has any comments, Ayrton, Stephen, did you have any other thoughts you wanted to add?
I'm fine, I'm okay.
Okay, all right, thank you.
Thank you.
Let's see, who else? Kidochukwu Prince Mekwunie.
Yeah, can you hear me?
Yes.
Good evening, and thank you for the contributions. It's quite awesome. I'm speaking from the field because WASH is basically what I do for the past 10 years. We have a challenge in Nigeria. The challenge is this. For every school, for every community that I have visited, there is an existing WASH facility. But maintenance, proper use and maintenance is the problem. That is the problem in Nigeria, proper use and maintenance. If there's no, most of the schools, as mentioned in the FCT, if you check very well, you find that there's an existing, abandoned wash infrastructure. So the question now is how do we increase the level of awareness against open defecation? In motor parks in Abuja, it's a common thing. You go to Jabi, go to Dede, go to Zuba. In all the motor parks in Abuja, open defecation is just a normal, it's a norm. And the facility available there is mainly run by the private sector that you have to pay to use. And judging from the poor economy, it becomes very difficult to tell someone who just came to the park to try to earn a small living to pay as little as 50 to 100 naira to use a toilet. He prefers to go and do it open, where he is not going to pay nothing. So we have to hold the government accountable a little bit. If there could be a way to synergize with the private sector to make this infrastructure free for usage by the public. Because paying for it, I think, discourages a lot of people from using it. Secondly, drug abuse, drug users. Those that mainly you see doing open defecation are mainly drug users. Where these facilities are available, those that want to smoke, you see them under the trees in the bush. They do both alongside. Then in communities, I think I listened to Doctor, he mentioned something about the olden days where we used to have sanitary officers move around every last Saturday of the month to inspect household toilet facilities. And then because of the enforcement, because you'll be penalized, I believe every household, when I was much younger, at the age of 5 to 10, I know that we have to keep our toilets very clean, knowing that they will come for inspection, and if it's not clean, we'll be penalized. But now, my question is, and I wish I have someone from the government sector here, those who have this responsibility in the Ministry of Environment or whatever ministry they are working, what are they doing? Or have they shut down that department in the ministry?
Yeah.
The government.
I don't think, Uchechi, correct me if I'm wrong, I don't think we have representation from the government today. But, maybe down the road, we could look at a collaboration to start a dialogue with what has been shared, because we need to make a difference, and to do it, we need to have people, like we've been talking about, involved from all walks of life. Uchechi, am I right? I don't think we have representation.
No, we don't have representatives at the moment.
Okay. But you bring up a very good point, that it's there, it's behavior, and then sustaining it. That was brought up earlier too. So Nanpet said that I encourage CEP and PHAAE to capitalize on recent declaration of state of emergency. Okay, yeah.
Yeah, the declaration was fine, but there's a problem. I will draw your attention to the Clean Nigeria project that was launched almost a year ago, or more than a year ago. And the idea of the Clean Nigeria project was to drive behavioral changes in people regards sanitation and hygiene. And I was privileged to be in their office, and I asked a question for an agency who has this responsibility. And if you go through their social media handle, they have less than 100 followers, and we are in a social media age where for you to drive in most of this awareness, you use the social media a lot. The question I asked them is, how are they making these changes? How are they driving their information down to the youth, to communities on artisanal changes? I think government is just, sorry to say it, I like being very factual. It's like just give a policy, have a good party, and sign some papers, but driving it down and implementation and sustainability is not there in the government sector. So we in the private sector have to bring them in and try to hold them accountable for their lapses, because they have the resources and they have the structure. It's easier to use their structure and their resources to achieve more results than us from the private sector.
Yeah, well said. I think there's another comment by Nena Didgo.
Okay, yes, good evening from this part of the world, and many thanks for the invite. Okay, I'm just following up with what the last speaker was saying. There's actually a duplication of rules between the Federal Ministry of Water Resources and then the Federal Ministry of Environment, which and I have known for quite some time. And part of our challenge has been getting some of these government offices to take responsibility and to take action. The Clean Nigeria Campaign Office, what are their major roles? The Pollution Control Department of the Federal Ministry of Environment, what are their major roles also? Everybody claims that working to end open defecation by 2025 in Nigeria, which we know is never possible for Nigeria, the kind of population we have. And then the non-ownership of policies. Okay, from years back, now 2 years ago, we went to a community in FCT here, just as part of the water toilet day activities. And to our amazement, there's no single toilet there. And they said to us that toilet is not their problem. That because they go out, hang around, discuss, and then do their whatever they're doing there. They don't need toilet, but they need water. It took us several repetition of visits for them to understand that there is water nearby that they could just run across to the community, but they need toilets since there is a nearby stream where they could put in maybe a machine and then pump water to the community. It took time, even though there was still some resistance and reluctance. When we talk about ending open defecation, there has to be community ownership, there has to be conviction. And government has to come in. It's not when it is World Toilet Day, we get invites from the government organizations that we work with as NGO, and then we spend our time going for meetings on end. At the end of the activity, nobody talks about follow-up until the next year. So it's okay. When I spoke with you, Cheche, I said, there's need for all NGOs in the area of WASH to have their own section. Forget government. When we have a common good that this is what we're going to be doing as NGO, coalition of NGOs in the area of WASH, it is easier to go as a group to lobby. It is also easier to mobilize resources. Because so long as you have government people, when it is multi-sectoral, you have government staff in your group, for every decision, the government officer has to go back to his supervisor to get an approval before he or she could come back to say, okay, this is what we're going to do in our own ministry.
Yeah.
But if it is NGO, they could write, they could lobby, they could resource mobilize. I understand what Dr. from Zamfara was saying about multi-sectoral, but you should also understand that I don't mention it, but that some of the ministries and parastatals are dodging their core responsibility. You see them once in a year or twice a year when there is activity that they showcase in the television.
Got it. Thank you. Yeah, thank you for sharing your thoughts. I think we are at the hour. It was a pleasure meeting all of you. Dr. Tukur, would you like to add anything?
Yeah, thank you very much. Thank you all for the comments. There's a lot of very insightful comments that we receive from our friends and colleagues that are out there working. All I will add up here is that like one of the participants said, is a big fight, is a big war that's needed to be fought on, and we need to ensure that we win this very big battle. You see, one of the health-related challenge that I wanted to mention that I did not mention is we've achieved success in eradicating polio in Nigeria, but this success is at risk right now because of open defecation. It's one of the predisposing factor for the polio-related infection and diseases. So we actually, as a country, needs to make sure that we maintain and improve our sanitary environment to ensure good health of the population. Thank you.
Thank you. Very well said. That if we don't put the emphasis and the time and the resources, all our past wins may not look like wins. And then we'll have a bigger hill to climb. Very well said, Dr. Tukur. Uchechi, do you have any last comments?
Yeah, I just say that this fight to end open defecation is for all of us. All hands has to be on deck. For those who have participated, you take the word out there and influence your environment on how to end this. It's not just about we NGOs to work and end this. We are all called to do this together.
Yeah.
So that's about it. Thank you all for participating.
Thank you. Yeah. So thank you everyone for joining us. It was a pleasure to meet you again. And hopefully next time we meet, we will be able to give you some idea of where our pilot program is. If we don't meet before the holidays, which we probably won't, it's in the next few weeks. Happy holidays to everyone from CEP and from PHAAE as well. Uchechi, please.
Yeah. Merry Christmas, everyone.
Okay, thank you. Bye.
Thank you very much. Bye.